Hi, my name is Justin. I've been living and working in Santa Cruz for 20 plus years. I'm a teacher and I also have a super active lifestyle, surfing, playing basketball, etc. Santa Cruz for me is it's great because it's a place where you can really have that active lifestyle, and I've been surfing for 30 plus years and just really love, getting out there. I tore the meniscus in my knee, both sides, and extremely painful injury as a result of basketball. Pain was absolutely a 10. And when I first did it, I knew right away, oh, my knee is broken, something's bad, and could barely walk. So straight down to the doctor, and surgery looked like that was gonna be the route. You go to talk to these guys and they show you the MRI, had an MRI, and he's like, okay, well, your meniscus is torn here and this is the surgery we propose and we're gonna do this. And it's a pretty good sales job. You get in there and you're in a lot of pain and they're like, this is how you're gonna fix yourself. And it's pretty compelling. I wanted some immediate relief with the pain, and I wanted another opinion. I don't like surgery. I don't know if anyone does, but I was really averse to it. And so I decided to give Glenn a try on the recommendation of a friend. And he took a look at the knee, and I could tell right away that he knew exactly what was going on with the knee, not just specifically related to that meniscus tear, but just looking at the whole body, nutrition, diet, lifestyle, all that stuff. So he and I worked together for a period of time, I'm gonna call it a month, working to reduce inflammation and take a look at an alternate route instead of surgery. My insurance covers acupuncture. As a teacher, I chose one of the health plans that covers it, and I use it, and man, it's super important to me. I think there was a period of time when I was not covered and I paid out of pocket because it's that important, but having it be covered through my healthcare is awesome, and I just really feel grateful that I can do that for sure. Yeah, it's covered. But the main thing at that point in time was this same old question of, okay, am I going to be able to return at any point in time to being a very active person? What I told Glenn at that point was, I'm coming to you with this injury. The surgery has been recommended. Do you think that I'll be able to heal this problem without surgery? That's a tough question. It's a big deal, looking at someone who has actually a physical injury in their body and what can they do to heal that. So that initially was, yeah, okay, we're gonna reduce your pain, we're gonna reduce the swelling, we're gonna get you back to daily functionality, and then we're gonna take a look at the long road of getting you back to being active again. And I was convinced at that point that we could do it. For my basketball, bicycling, surfing, knees is crucial, right? And you want to feel like you're relying on your body in this critical moment, whether it's surfing or jumping or whatever. And if you don't have the confidence in your body, then you can't perform. And that's one key element when we're working with Glenn, is to be able to say, okay, the knee's good again. So I always ask him, what percentage would you put me at in terms of my performance? Can I go 100%? And he's really good about gauging that. In the early stages, it was like, okay, you want to be careful and guarded. You can go back to biking, walking, etc. But now my confidence is 100% in my knees. I'm surfing with total confidence in my knees, no issues, and really glad I didn't decide to do surgery. The outcome was great. So no pain, reduction in pain is, I'm pain-free in my knees. Really glad I didn't have to do medication for pain management. Really kind of opposed to that, and that was another great outcome of working with Glenn. I just didn't have to go that route, didn't have to take drugs to ease the pain. I refer Glenn, and I would refer Glenn to anyone who's an athlete who's looking to make their body function at top level. Anyone who's had an injury, who's thinking of different treatment methods. I think that the thing about acupuncture is that people don't necessarily associate it with sports medicine, and our tendency as athletes is to think about Western medicine as repairing the body and stitching things back together, right? And so my approach to injury is, who can I look to have my body heal itself, right? Because that's the thing that I rely on, is that my body is actually really good at this healing process, and Glenn's excellent at having the body help itself to heal itself without surgical intervention. So I think that's a big appeal for working with Glenn. And yeah, of course I recommend him all the time to friends and loved ones.